We're live on YouTube right now, and then we're gonna go live on Facebook. Very good. We are live on Facebook and YouTube and also the website mvtonline.com or mikevanthielen.com. We have had some technical issues with Facebook, probably things that are going on behind the scenes with Facebook and the deep state and whatever's going on. They're blocking a lot of posts, and every day when we try Facebook, we have some issues. Facebook is going well, but the audio is not coming from the microphone here. It's actually coming from, is a little bit less clear on Facebook. So you can always click the YouTube link on Facebook for a better audio. But we're here today. We're going to talk about acupuncture and Oriental medicine. We're going to get a little bit more insights, overcoming some barriers that are out there for people to seek this type of care, and talk about some of the applications that most people are not aware of that this medicine and acupuncture can help with. So today we have our special guest here, Dr. Lorenzo Fan.
Yes.
How are you today?
I'm doing fantastic. Thank you.
So Dr. Fan is an acupuncture physician, doctor of Oriental medicine, and he actually was born in Vietnam. Tell us a little bit where you were born, where you grew up, and how you ended up here in the United States.
I was born in Vietnam, and we escaped from Vietnam because of the government issue, and we landed Hong Kong. My dad is Vietnamese and my mom Chinese.
Okay.
And we landed Hong Kong. My dad is American veteran. So we are very fortunate that the U.S. government sponsors our family to America in 1986.
Okay, so that's when you came here.
Yeah, when I was about 16 years old.
So you were 16, and that's when you came to the United States.
Yes.
Didn't speak a word of English, I assume.
No. English was foreign to me.
Yes. Well, you're doing very well. You've been here for a while now.
I've been here for a while, but you start to pick up a new language at 16. There's a lot of challenges.
Sure, there is. And then right now you are practicing in Ormond Beach. Your clinic is called Acupuncture and Skincare. You're here in Ormond Beach. So let me ask you, how you came here when you're 16. How did you get interested in acupuncture and Oriental medicine?
Well, our family, this is my 7 generations. However, I didn't get into it until I get a weight-lift injury.
Okay.
When I was at senior at University of Hawaii, I do some weightlifting. I got injury. My injury my lower back, the lumbar 4 and 5, for create herniations. The L4 L5 disc was herniated, and I couldn't walk for 2 weeks. And then so I went to rehab for 6 months, 3 times a week, with acupuncture therapy and manual therapy.
Okay. So a combination of physical manual therapy and acupuncture.
And yes, and it saved my life.
Okay.
It saved my life. So from this positive experience, influenced my decision to study acupuncture instead of internal medicines. Because back then I graduated from University of Hawaii as a biochemistry major.
Oh, okay.
So
your idea was to become a regular doctor?
Internal medicine.
Yeah,
I was complete my pre-med training.
Very good. And here you are being an acupuncturist, doctor of Oriental medicine. Tell us a little bit about the history of acupuncture thousands of years ago in ancient China. How was that used over there?
Acupuncture originates in China over 2,500 years ago. Back in the olden days, there's a group of thousand physicians. How they discover acupuncture is they study pressure points. Back in the day, and they use stones to massage certain pressure point along your body.
Huh?
Yeah, stones. Right now we have hot stones for massage, right?
Sure, yeah.
So they use the stones and bamboos. You talking about 2,000 years ago.
Sure.
So if you have a shoulder injuries or pain, they kind of use a pressure point along it, and they kind of map it out little by little over time, try and error for thousands of years. And that is how acupuncture was invented by these group of famous physicians in the olden day. Right now, is widely used all over the world.
Yeah, sure.
Acupuncture therapy.
So yeah, it took a long time for them to discover and map out the whole body and all the acupunctures and which point influences which system, which organ, etc. And it's a very effective type of medicine. So how did it end up in the United States? How did it come over to the United States?
Very fortunately that in early 1972, when our president Richard Nixon had a meeting, economic meeting with the Chinese leaders.
So he was over there.
He was over there, and James Reston is the New York Times reporter. Came with the president, and during the visit, he ruptured his appendix.
Okay, like an appendicitis.
Yeah, he ruptured appendix. And James he allergic to anesthesia, so you can't use anesthesia to operate.
Yeah.
So they use acupuncture therapy as a form of anesthesia.
Anesthesia to do the operation.
To do the operations. So the operation was successful. Plus, they use acupuncture therapy to provide natural pain relief for him post-op after the surgery to help him recover. And after that, he was impressed with the technique. So when he returned to the United States, he wrote a long article how acupuncture helped him during the operation.
Helped the president.
Yeah, and after, and after the surgery, and that's how acupuncture
was introduced in the 70s.
In the 70s.
All right, well, excellent. That's a great story. As an acupuncture physician, we always treat our patients and we treat the body as a whole.
Absolutely.
Right? So when we have a patient coming in with back pain or any other, medical condition, of course we talk about that specific condition. But as an acupuncturist, and I'm a licensed acupuncturist also, we look at every system in the body. So even if they come in with back pain, we talk about their emotions, we talk about their bowel movements, we talk about about if it's a female, about their menses. We check and look at everything and ask hundreds and hundreds of questions, and we check many different things because we want to have the entire picture. Because we don't want to treat the symptoms, we want to try to find the origin or the cause of the problem so we can address the cause of the problem. And that's why an acupuncture physician, doctor of Oriental medicine, they do a very extensive intake and assessment. And during that assessment, there are a few things that may be surprising or odd to a person from the United States, because we do a pulse diagnosis. We look at the tongue. Right. So tell us a little bit about those pulse diagnosis and tongue diagnosis and why we do that and why are they so important in making that correct assessment.
I think you are, absolutely right about. Besides, we look at their medical history. As the Western physicians look at their medical history. On top of that, the TCM, traditional Chinese medicine practitioner, they look at the pulse and the tongue. Is very important to combine with the patient physical sign and symptom to confirm or to double confirm about the disease process. So when you look at the tongues, you can see what organs, because as we study, there is a different organ reflects what's happening to reflect the internal bodies.
Yes. So you use the tongue, and based on the color, whether it's swollen, based on where or which part of the tongue is affected, a doctor of TCM can basically identify where the trouble is inside the body.
Exactly.
Correct?
The condition or the disease reflects on the tongue. I give you an example. If there is a part of the tongue like more posterior, if there's a black dot or black area behind the back of the tongue. The back of the tongue, that would indicate that there's a kidney cancer. If there's anything that
the kidney issue,
black, there's a kidney issue. So
now what I remember is if the tip of the tongue is
the
red,
heart. It's the heart.
That's the heart.
The heart in emotion.
Yeah.
So when you look at the tongue and there's a lot of those micro dots, red dots.
Yeah.
That means you are very stressful, very emotions.
Fire in the body.
Fire in the body.
Yeah.
So so that's why when
So there's besides the regular conventional diagnosis, the medical history, the questions, the examination, the palpation, a TCM physician is going to look at other systems like the tongue, which may be weird, but it tells them a little bit what else is going on in the body and what may be causing that condition. Correct?
Yes, it based on science. It's true. It's like your eye when you have a jaundice, right? That reflects your livers.
Sure.
Right?
Yellow. Yeah.
Yellow.
Yeah.
So outside does it reflect inside. Another side note I like to add on is there's a famous doctors in California. They do facial diagnosis. They look at your face and then analyze very meticulous, very details, and they know where the disease come from. Yeah. What organs. It's amazing.
Complexion and everything else.
Everything else. I mean, it's an art and a science.
Yes. Well, very good. So people, when they hear acupuncturists talk about chi and about meridians, I think they get a little bit distant because they do not understand the terminology. And I think it has been a big barrier for people to seek out care from a TCM practitioner because they're uncomfortable with the terminology. And so, because we talk about chi and meridians, right? So what are meridians and what is chi?
You are right about those foreign terminology that, people don't comprehend what's the principle or the concept behind the chi. The chi, if you study biology or chemistry, the energy, the cellular energy we call ATP. Yeah. It's the energy of the cells. So that is the chi. It literally translates to the Western term is a bioelectrical energy because bio is a living energy, living energy, bioelectrical.
Okay. And meridians.
Meridian is the pathways of the energy travel. You think about the myofascial connections, and it's very close to neurological pathway. Yes. Very close to neurological pathway, the meridians.
And so Dr. Fan is correct here because even though it's a different terminology, we're still talking about the same body and the same science. And so when people say, well, meridians, I don't believe in meridians because if we cut open the body and we're going to look for those meridians, we can't find them, right? Because they're energy pathways. So people say they don't exist. But see, in traditional, conventional medicine or Western medicine, it's the same thing. And I got a few examples, right? We always talk in Western medicine about the sodium-potassium pump, right? The sodium-potassium pump is basically an active transport system of molecules that basically go from a high concentration to a lower concentration, okay? So it's energy molecules that are moving.
Right.
In this case, the sodium ions are moving out of the cell. The potassium ions are coming in the cell. And the sodium ions on the outside of the cell are now basically adhering or clamping to the pump. And so is the phosphate group of ATP. And that's how the pump works. And that's how the pump changes shape, right? So, but here it is. We always talk about this sodium-potassium pump. You can open the body. Do you think you're going to find an actual pump?
See?
No, you're not going to find the pump either. It's a concept. It's a theory on how to explain how things move, how that ATP is made, how that chi is made. But it's the same thing. Chi is energy, ATP, and meridians are energy pathways, right? And so it's the same. It's just a different word. But besides the sodium-potassium pump, in our medicine, we talk about diffusion. Again, what's diffusion? It's basically the passive movement of particles like ions, atoms, molecules, from a higher concentration to a lower concentration until the concentration is uniform. We talk about osmosis in Western medicine. Again, you can't find osmosis when you cut open the body because it's a concept. It's a movement, right? And osmosis basically is we have a semi-permeable membrane, a cellular membrane. And so again, we have water that moves from one side of the membrane to the other side of the membrane, until the concentrations are equal.
Absolutely.
We have ion transportation, meaning there's a charge, an electrical charge. And we know that opposites, what do you say? Opposites repulse or move away from each other. No, opposites attract. And the same charges, repel. Right? So all these things in Western medicine that we talk about, the pumps, diffusion, osmosis, hydrostatic pressure, all those things are terms that we do accept. But when it comes to chi or meridians, we don't accept them. And it's exactly the same thing, okay? So I hope you understand that the terminology, is a little bit, difficult, but in reality, it's exactly the same. It's the same body, the same physiology that we are talking about. I think, though, that the TCM practitioner or acupuncture physician working in the Western world should use the Western terminology instead of talking about chi and meridians. The reason why I believe that is because you will overcome that barrier trying to get patients into the office.
I think, Dr. Mike, I think you're absolutely right. I like your how you use the example of sodium, potassium pump, and osmosis because, as you know, it's a cellular energy, right? And like you say, if it open up, if we dissect the body, we don't see that pump.
We don't see the pump and we don't see the meridians because they're energy pathways.
Energy does exist. You think about in reality, if we can
measure
tired,
it. There's several ways to measure it objectively.
That would be great someday. But let you think about it. If when you feel tired, you feel tired. But there's no such a machine out there yet. I don't recall that can measure the amount of energy the human body have. And look at the and gasoline.
But we can measure energy. That's why we can find meridians. We can find energy. Biophotons emit light all the time. Yes. We can see it with our eyes, but there's equipment that we can, identify that with. So what I'm saying is it can be scientifically proven that there's energy. We're all energy. Energy holds us together as a human body.
Without energy, we can't function.
We certainly can't function. Now, how does acupuncture work then? How does putting a needle in one of those acupuncture points, how does that then work or affect the body?
Let me go that. Okay, let me focus on a little bit. The micro needles, right? They stimulate the sensory nerve ending that send the impulse up through the spinal cord to different area of the brain, causing both local and central acting effects. By stimulate these points, the body start to restore the normal energy flow balance and stimulate the body ability to heal. So what it does, there's under the pressure point, there's a neurons, there's the sensory nerve, and it sends up to the spinal cord and to the brain, and the brain will
resets.
Will tell what the body what to do.
So that's how that works, right? And it makes sense. Do I always explain it? An acupuncture point is like a neurovascular node. For example, many trigger points are acupuncture points. They coincide because it's a sensitive point. It's an ouch point on your body. And the reason it's ouchy because there's nerve endings underneath the skin. And those nerve endings obviously connect with what? With the bigger system, right?
Absolutely.
So when it comes to putting a needle in one of those sensitive acupuncture points, there's actually 3 responses in my opinion. Number 1, there's a local response. Because even though it doesn't hurt, because it's a very small needle, we'll talk about that in a little bit, you are causing a micro trauma. And when we cause a trauma to the body's going to respond. And the way it's going to respond, it's going to send more circulation, more blood to that area. And blood is healing, right? So we have a local response. Like Dr. Fan said, we also have a systemic response because all those neurovascular nodes, they have some kind of a connection, neural connection or axon connection to an organ or to a bigger system in the body. For example, on the back, on our back, next to the spine, we have many, many acupuncture points. For example, between our shoulder blades, we have what we call the back shoe points or the bladder points. Now, bladder 13, for example, and correct me if I'm wrong because it's been a while, is used to treat the lungs.
Yes.
So it's a bladder point. It's a point between the shoulder blades right next to the spine, and it's a very important point to treat the lungs. So when you say that to a Western person, they say, why would you use that point to treat the lungs? Well, actually, there is a connection. There's an axon that runs from that neurovascular node, bladder 13, to the lungs. All right. So there is a physical connection between those points and certain organs and systems. And then the third response that we get is a referred response. Just like the same with trigger points, right? If we have a trigger point affects a certain area. A trigger point affects a dermatome, for example. We know all about sciatica. The problem starts in the back, but we have a certain, pain pattern all the way down the leg, because that's where the nerve runs.
Yes, absolutely.
Okay? And so, it could be like a trigger point. An acupuncture point could affect a certain area. Okay, so that's the third use. We could use it to diminish referred pain or affect an area that it is, integrating with.
Yes, acupuncture. When we look at the neurological pathway or the anatomical, we can see that, like you say, there's a root in the peripheral. When we treat sciatica or shoulders, those are pressure points that it connect to the particular muscles and to the nerve. So when we treat the spinal issue, we use local but also distal point to promote the blood circulation and reduce the inflammation to heal that particular very specific tissue.
So we have a local effect because we initiate the healing process and getting blood flow there, but at the same time we're affecting the cause because we have that,
the distal point, in conjunction to help heal the local area.
And so many times there is actually a connection, whether it's a neurological pathway or an axon, and sometimes it's not necessarily a physical connection, it's an energy pathway, and that are the meridians. Because even today, in my practice as a physical therapist, when people come in with a frontal headache, many times I put a needle or even do an electrical stimulation or acupressure of gallbladder 41, which is in the foot. It's an acupuncture point in the foot, but it's on the gallbladder meridian. And this point right here is also on the gallbladder meridian. And it works every single time. So there's not really a physical connection between them, but there's an energetic connection between those 2 points. The way I explain it to my patient often is it's like a garden hose. You can open that garden hose to water your plants, and sometimes nothing's coming out on the other end, even though all the water's going in, because there's a kink in the hose somewhere.
Absolutely.
And so we gotta go to where the kink is, right, to fix the problem. So we can't, and that's a distal point. We can fix things from a distance as long as there's an energetic connection or an actual neural connection.
Another simple way to put how disease arise is like 95. There's a lot of traffic. There's a lot of congestion. There's a lot of stagnations.
Correct.
So if you use acupuncture, the distal point, just to move them. And that's you align them and let them move. So you clear, clear the traffic.
Now, when people hear needle, a lot of people freak out because nobody likes that word needle at all, right? So especially when we have to get an injection or blood drawn, what's the difference with acupuncture needles and the needles that people know?
A lot of people are afraid of acupuncture because of the needles issue. Acupuncture is like microscopic. It's as big as your hair size. It's as thin as your hair size, and the injection is like 30 or 40 times bigger.
Yes, and that's the key. They never should have called it needle. Again, terminology is important. They should have probably given this tool a different name than needle, because these fine acupuncture needles, they don't have a hollow. A regular needle has a hollow because we want to inject something or we want to draw something. These needles don't even have a hollow. They're so thin that many times I laugh because I put people on their stomach to treat their back. And after I put the needles in, I ask them how many needles are in, and they don't know. They say 2, and I got 4 or 5 needles in. They don't even know because it really does not hurt to get those fine needles in. So maybe we got to come up with another name so people don't freak out because it really doesn't hurt. In acupuncture, we talked a little bit about the diagnosis, but in acupuncture, besides using acupuncture points and distal points that we just discussed, a lot of acupuncturists use what we call microsystems. We talked a little bit about the tongue being a microsystem, but when I was in acupuncture school, a lot of my colleagues, they really specialized in ear acupuncture, for example.
Yes.
Explain that a little bit, because they use just the ear to treat everything.
Germany, who invent this, they use a special technology where they put a pressure point here, and different part of your organs or body reflect on that. So lately, in the last decade or so, the auricular has been very popular. They use it for drug addiction. for weight loss, for appetite, and for pain. All different kind of pain, because there's a reflective point, pressure point for different part of the body. It's amazing. It's like you say, it's a microsystem.
I've seen it work.
They use in battlefield now. They use there's about 5 years ago. There's a few hundreds physicians trained in auricular therapy to help out shoulder for pains, for battlefield pain, and insomnia.
Because there's nothing else available.
It's quick fix, and it's amazing. The result is amazing. It's an instant result.
Yeah, that's great. Now we talk about conditions. What are some of the general conditions that we can treat with acupuncture? Because most people think that acupuncture only is for pain, but there's so much more. So tell us a little bit about other conditions that are treated effectively with TCM and acupuncture.
These are the found disease or condition for which acupuncture had been proved through controlled trials to be an effective treatment.
So these are the scientifically proven benefits.
Yes.
Okay. Which are those?
First one is the adverse reaction to radiotherapy or chemotherapy, allergic rhinitis, depressions, dysmenorrhea, gastritis. That's mean the
gastritis.
Inflammation of the stomach. Facial pain, TMJ. If you have TMJ or facial pain, or even Bell palsy, it works wonderful. A lot of people don't know about it. Hypertension, knee pain, lower back pain, neck pain, shoulder pain, sciatica, sprain, stroke, and tense elbow. I like to emphasize about stroke.
Okay.
I mean, there's a lot of people had stroke every day. Okay. Acupuncture and physical therapy is a perfect combination for stroke rehab. Why? Acupuncture work on the nerve. It restore the function of nerve. Physical therapy strengthen the muscle, balance the muscles. These two combo is perfect.
They work good together.
It's so effective. In China, we use this a lot. I mean, every day in a hospital setting.
Oh, I know in a hospital setting. I mean, when I was in acupuncture school, some of my fellow students went for internship in China. And so when they came back, they had all kinds of stories, obviously. But one of the stories was when somebody would come in with a stroke, acute, immediately the acupuncturist would be there to put needles in the scalp.
Yes.
Why? To force circulation to that area, to minimize the potential, side effects or the ramifications of the stroke.
Yes. And also the other form of stroke is that the blood were clots, and use acupuncture onto fingertips, or there's a pressure point. We literally help break those stagnation.
Those are emergency points.
Those emergency points, and it saved life.
Great. Now, in old ancient China, there was no electricity, so they didn't use electrical stimulation. But now there's many acupuncturists that after they put the needles in, some of them do it the traditional way. They just put the needles in and they come in every so often and kind of stimulate the needles manually. But many acupuncturists kind of take a little bit of a jumper cable and put it on the needle and basically stimulate it electrically.
Yes.
Do you do that at your office? And what's the benefit of electrical stimulation?
The electrical stimulation, some patients respond favorably. Some people don't notice the difference. So it helps to activate meridian, and also break up the muscle spasms.
Yes.
Those improve circulation.
So from a Western point of view, I would say that when we put in the needle, we get a response, right? But we only get one response. We stimulate it once. But if we put an electrical current on there and we let the patient lay there for 20 minutes, guess what? It continuously gets stimulated for 20 minutes versus only that one time.
Absolutely. It replaced for manual therapy.
Yeah. Okay. Very good. The way I use it often also in a physical therapy setting is in physical therapy, we have those skin patches. Like most people are familiar with them. When you use a tension unit, you get a skin patch and you feel it tingling on the skin, right? And it may or may not work because what it's doing is basically that current is blocking the C fibers, the pain fibers, and it's stimulating the alpha beta fibers, which are the ones that feel good, like when you get rubbed or when you get a nice massage. So what I do often is I replace that skin patch with an acupuncture needle. And I'm not necessarily putting it in an acupuncture point, but with the needle allows me to go where I want to go. In other words, if we have a soleus muscle or a deep low back muscle or a quadratus lumborum, if we use a skin patch, that electrical stimulation is not going deep into the muscle, right?
Absolutely.
We're feeling the tingling superficial, but we're really not affecting the area that we want to affect. So a 1-inch, 2-inch, 3-inch, or 4-inch needle allows me to go exactly to the muscle that is in trouble, or getting into a knee joint, and then conducting or transferring that stimulation to those deeper structures. And so as a physical therapist, I can do that because I'm stuck with the patch. So that's another application to use those
It's more
needles.
effective. It's very effective. Recently, there's many study that doctors utilize acupuncture and physiotherapy, and I think it's a perfect combo.
The combination.
Because number one, you recover faster, and you improve the outcome maybe twice or 3 times more.
And it's great that you mentioned that, but this is how I got introduced to acupuncture. I came here as a licensed physical therapist, and after a few years, I started working with acupuncture and physical therapy specialists is the name. They're still in business. One of my great mentors, Dr. Wang, Chan Cheng Wan, he hired me as a physical therapist, but in the clinic, we were combining acupuncture with physical therapy. And so I witnessed the results are the synergy of the both therapies, and we had better results than physical therapy by itself. And so that's how I got interested, and that's how I went back to school to the Florida College of Integrative Medicine and got my license in acupuncture, became a doctor of Oriental medicine, homeopathy, injection therapy, and all the kind of stuff. So I certainly have that background, and that's how actually I got introduced to it as a physical therapist.
I think that's just great, and I hope that recently there's more insurance cover acupuncture because of the cost effective.
Yes.
It's amazing.
Sure.
So certain conditions like sciaticas, migraine headaches, spinal pain.
I had a patient yesterday. Again, I work part-time in a physical therapy place. Humana is now covering acupuncture.
I'm the providers.
And you're the provider.
I'm the providers.
I did an acupuncture treatment yesterday, and it was covered for the patient by Humana. So that was good, because in the past that didn't work. Do you combine acupuncture with herbal medicine?
Yes, absolutely. Certain conditions that I treat very effective is fertility issue. Fertility issue, you have to combine with herbals to regulate the cycles, the menstrual cycle, improve the energies. Also, the other condition I use quite a lot is the menopause, hot flash menopause. A lot of women out there, if you have hot flash, use acupuncture and herbal. It works 90% of the time. So
high success rate.
Highly success rate. And also the secret we're going to leak out today, acupuncture not only help with hot flashes, it help with the belly fat. If you specialize, know what to do with that.
Yes.
You have to train. Okay. You have to ask the acupuncturists that they train in the weight loss too. So if
again, just like with any profession, there's always specialties within that profession, right? So I know we talk about skincare in a little bit because you specialize in skincare, weight loss, those types of things. So yeah, I mean, as a consumer, you always ask, this is the condition I'm coming for. What is your expertise? How many patients have you treated with my condition?
Right.
And what is your success rate with my condition? Because everybody has a different specialty or what they're good at within their profession, for sure. Now, I always like the herbal medicine component of traditional Chinese medicine because it's very customized. Again, it opens your eyes when you're looking at Western medicine. There's just one drug for everybody, right? Here's a high blood pressure drug. Here's this drug. And it doesn't matter who you are. Everybody gets the same thing. It's a one-size-fits-all approach. But in traditional Chinese medicine, we do this whole elaborate intake. And so based on your Chinese medicine or TCM diagnosis, they will basically customize the medicine or the herbs just for you. And that's kind of very unique, because if two people go in with the same condition, they're not getting the same acupuncture treatment. They're not going to use the same points. They're not going to use the same herbs. And that's what makes it so unique, because they're looking at the entire body. They're looking at the whole complexion. They're looking at everything as a whole. And that's why it's obviously a lot more successful, especially when it comes to achieving long-term results.
Yes, you are right. It's I'll give you a real example. There's 2 patients come in for insomnia. All right. One patient have a difficult falling asleep. One patient have a difficult staying asleep. You cannot use the same point. You have to use a different combination, and you have to use different herbals. Even the fertility issue. So yeah, like you said, you are right at the point. You have to why TSM had a successful rate because we customize, and individualize and personal care.
Because people always come in complaining about symptoms. So as a good physician, you got to figure out what's causing those. And the same symptoms in different people may be caused by different causes. So that's why there's different treatments.
Absolutely. We have different organs. We have 11 organs in our body, and there's thousands of muscles.
Yes, exactly. We all know about cupping, okay? There's always a controversy out there, and I smile when I say it, because when I talk about cupping, we have these scientists among us that say there's no science. Well, first of all, when we talk about Western science, we're usually talking about one study that has been done by the beneficiary, and I'm talking about big pharma. That's very laughable. When we talk about medical marijuana, when we're talking about acupuncture and those types of things, we're talking about our CBD oils. We're talking about thousands and thousands of studies done over decades and decades and decades all over the world. Now that's research, okay? But when it comes to cupping, there really doesn't have to be research. There has to be simple common sense, because with cupping, we're just drawing circulation to a certain area. And we know that circulation helps healing and helps relaxing and those types of things. So I don't know why people are crying about, a technique that supposedly doesn't have peer-reviewed blind studies when we just talking about cupping. So explain to our viewers, I think this is amusing, what cupping is and what the benefits would be. Because we all know about Michael Phelps and the Olympic Games in Rio, where he was, going for gold so many times again, and he had all these cupping marks on his body. So what is cupping and what do you use it for, Dr. Fan?
Cupping had been utilized in Asia or maybe Western for thousands of years. It just like we lose it over time. Cupping therapy is excellent. It's very good for a patient who had muscle spasm. Why? Cupping, as you know, that there's this pressure that will suck it up. Think about it, when you put the pressure and suck it up, and the underneath of different layer of muscles, what happened? It improves the circulation.
Sure.
So if you have a lot of inflammation, it can flush out the inflammation, had more circulation to tissue, and the tissue will heal.
Of course. It's simple.
Besides, relax the muscles, get more circulation, but also promote tissue healing.
Yeah.
That's why famous athlete or right now, athlete all over the world use cupping before the match, before the competition. Why? It improves the joint flexibility, improves circulation.
It lets go of the tension.
Exactly. Let it go tension. And
for those who know what cupping is, it's now they have pneumatic cups. It's plastic, and it's, just basically, with a little gun. The original way was with glass cups, and you actually have fire and a cotton ball and alcohol. And what you're doing is you're basically sucking the air out of the cup, turn it on the affected area. And what it does, it's basically a suction. It's just a vacuum. It's a suction. So it becomes very red. What it means is it's drawing the circulation to that area. So it's very effective for the tight muscle, a muscle spasm, etc. And when you do it very strongly, yes, what you're doing is you're causing micro trauma, just like you do with a needle, just like you would do with a laser. You cause micro trauma, and what that does is it initiates the healing process.
Yes, but also the fire cupping, if you're not training it, I would not recommend you try it at home.
Hair on fire.
Yes, please don't try it at home. This is for professional, trained persons.
And then there's one more thing we talk about that TCM practitioners do, and it's called moxibustion. And for the older people under us that used to watch those action movies with Steven Seagal, he used to kill 100 people in the movie, but then when he had to recover or he had some wounds, we know that in the Terminator, Arnold Schwarzenegger, puts his own eye in with a needle and stuff like that. And in the Rambo movies, he sews himself back up too. But Steven Seagal didn't do that. He would kind of put some needles in, and then he puts a herb on it, and it would, on the movie, it would kind of smoke, and it would sit there, and it would meditate. And the next day, he was ready to go kill 100 people again, right? So it's called moxibustion or moxa. Tell the viewers what it is and what it's used for.
The moxa is the dry herbal. They either roll it up as a ball or a cone. And once you put the acupuncture and then you replace on top of it, what it does is enhance and activate the pressure point. So it promotes the healings.
So it's an herb that we basically burn on top of the needle, and it really increases basically the heat, but it creates a vasodilation. Because I believe, if I'm not wrong, it goes up to, you don't feel it, but it burns up to 700 degrees Fahrenheit.
It's pretty hot,
Yeah.
so you have to be very cautious about it.
It's actually pretty funny because the first time I walked into the office where I was going to work, and the first time they did the moxibustion, I thought somebody was smoking weed.
Yes,
because it kind of smells similar, right?
absolutely. It smells like marijuana. It smells like marijuana.
So don't run out if you walk into an acupuncture. Nobody's smoking weed. They're just doing a treatment with this herb that has a similar smell.
Similar smell. You got it right.
We talked a little bit about acupuncture helping fertility and hot flashes and stuff. Tell us a little bit more on how that works then.
The fertility is, I give you an example. My friend, she's a pharmacist, very stressful jobs, and her cycle is off. It's like 2 months, 3 months, irregular cycle. So what I use acupuncture is I regulate the cycle. So her cycle becomes regularly.
Okay.
And then I prescribe some herbals to boost up her energies and de-stress. Believe it or not, she tried without acupuncture for 2 years. She's a pharmacist. She kind of, don't believe, say, hey, let me try the Western technique first.
Yeah.
So she came to see me, and I say, I need your help because I tried the Western technique for 2 years, and I'm in my 20s, and my husband want a baby. So, and I use acupuncture with her once a week and prescribe her some herbals. Within 4 months,
pregnant.
Boom, pregnant.
Same thing. I've not had really long acupuncture practice. When I graduated, I did acupuncture probably for about a year and a half. It was a lot of fun. I learned a lot. And we had one patient coming in for fertility. It was a colleague, friend. Same story. We just did acupuncture. We gave her the right herbs, and boom, pregnant. And I actually just met the kid, which is, I think, how old was he? 10 or 11 years old. I just met him, and there he was. Right?
I'm very excited about this. Acupuncture is very cost effective for fertility. The thing about it, if you do in vitro and Western technique or remedies, it can cost 100 times or 10 times more. And I think acupuncture and herbal maybe costs about,
it's very cost effective.
5 or 10% is the most.
Yeah.
Compared to the Western
so always good
modality
to try the non-invasive, cost-effective way. It can't hurt you.
No. I think it's the cheap ways to get a baby.
The last few years, I really heard a lot about acupuncture and addiction. Even the addiction centers in the United States have acupuncture as part of their treatment right now for addiction. It has been proven over and over again, and even conventional centers that treat people with addictions have acupuncturists on staff. So explain that.
Acupuncture is great for any kind of addictions, even like cocaine, marijuana, because what happened is we use a lot of pressure point in the body point to reprogram the brain. That's the interesting. Okay. To change the chemistry of the brain and to restore and balance, because acupuncture is well known for balance internal organs, neurological condition, also any kind of chemicals off balance.
Yes, very good. Because I've seen that more and more in just even regular addiction clinics, not traditional medicine, conventional clinics, and there's the acupuncturist being part of the protocol.
It's a cheap way to eliminate your bad habit.
Now, your business is called Acupuncture and Skincare here in Ormond Beach, and so tell us a little bit about the skincare. What do you do, and how does acupuncture has anything to do with skincare?
That is a very interesting question. Is as you know, our skin problem is originate from internal organs.
It's our biggest organ,
right? So when I deal with skin, we deal with treating the GI and the lungs. I find out a patient who have psoriasis or eczema or acne. Those are my 3 conditions that I specialize in. It came from the GI issue, from the lung issue.
It's an expression from another internal problem.
Absolutely. So once you correct those internal organs, the skin is become normal.
Again, in conventional medicine, we just go for the symptoms. We put a cream on. We're trying to fight the symptoms, and this is just an expression. Your body's trying to get rid of toxins. That's basically what it's doing, and the skin is one of the ways, to rid the body of toxins. And so, in order to get a clear skin, get a beautiful skin, you need to balance your internal organs, and you need to get healthier. Period.
Absolutely, you have to correct what's going inside. What is the inside reflects outside.
Okay. Who can perform acupuncture in the United States?
The best one would be the doctor of Oriental medicine, who had been thoroughly went to 4,000 hours of training. 3 years as a postgraduate. You have to have a college degree and training it. But also the MDs, what we teach MDs a 300 hours program, but who most qualified is the DOM.
Yes. So, and I agree with him. There's many chiropractors, and again, I got many friends, chiropractors, great people, great healers. But there's many chiropractors that provide acupuncture, but they basically had a weekend crash course. And it's not that they can't get a result, but they don't have the education and the background on how all the systems work, all the meridians, all the Zhengfu organs. They didn't get a 3-year education. They got it in a weekend. So if you just want to get some pain relief, I think they can be very effective, combining the therapy and the chiropractic with the local response of the needles. But you have more complex issues. If you have infertility, if you have female problems, if you have some kind of a syndrome or autoimmune disease, you really need to go to somebody who had a 3-year education, and that's a doctor of Oriental medicine.
Yes,
correct?
you have to, absolutely. If you had complex issue, internal organs, fertilities, skin issues, respiratory issue, you need to seek out DOM.
Yes.
Because DOM, they spend tremendous time study in depth about neurological, about internal system, how it affects your body overall.
Yes. And not just that, because it's not just acupuncture. Again, we learned today there's herbal medicine, which has its place based on your condition. There's moxibustion, there's cupping, there's all kinds of these other modalities that are appropriate with certain people and certain conditions. How many, for our viewers, and we're almost there, how many treatments does it typically take for somebody to feel better?
It depends. If acute problem, let's say you fall and you sprain your ankle on your knee, it might take 1 to 3 sessions or 6 sessions. It's very quick and fast. But if it's chronic, if you have a disc issue or sciatica issue, it can take 6, 10, 15, 20 times. Depend how severe the condition is and how long the condition it happens.
Yeah, so that's very individual.
Yeah.
When people want to, are interested, especially after hearing this podcast, maybe I'll give it a try. They obviously can contact you, but what can they expect? Can they come for a consultation, and can you kind of project on how many treatments they need? Because people are always, worried about money. Some insurances now, luckily, are covering it, but would you give kind of a prognosis and a projection on how many treatments they need?
Yes, based on my 14 years of clinical practice, but after I complete the physical examinations, went through over their medical history, their conditions, 80% to 90%, I definitely know how many sessions I need per case to case and person to persons. Also, good news out there. There's Humana Go Plus right now. They cover 25 visits free.
Yeah.
For if you really need it, medical necessity. Federal Blue Cross Blue Shield cover 24 visits for free.
For physical therapy in the state of Florida is direct access. You really don't need a doctor script, but the insurance makes you to have a doctor script. Otherwise, the insurance doesn't pay. So you kind of need a doctor script or insurance doesn't pay. For physical therapy, if I want for acupuncture, if I want to come to you, do I need to get a script from a doctor first?
No. We because no, there's no prescription necessary. Because we are a doctor of Oriental medicines, we qualify to do diagnosis and treatment. Those are a bonus.
So you can contact the acupuncture physician directly. You don't need a script from your doctor to go there, and they can see if your insurance would cover it or not, and they can take care of you. You don't need to involve your doctor.
Yes, no referral needed.
How can people contact you, Dr. Fan?
The best way, you just Google Dr. Fan in Owen Beach. You don't have to remember anything. Dr. Fan in Owen Beach.
PHAN.
Right.
And what's your website?
The AcuBeautyTherapy.com.
Acu, A-C-U, 1 C.
One C.
ACUbeauty.com?
No, BeautyTherapy.com.
Okay, ACUbeautytherapy.com. I will post it on the Facebook page there too. And is there anything else you want to share with our viewers today?
One thing I want to add, this is on the side note before we end our podcast. I would like to share a brief note on the veterinarian perspective on acupuncture. The veterinarian experience with acupuncture is a powerful validation of these techniques. As you know, animals, of course, are not subject to any placebo effects. They have no expectations or belief in a treatment method that could translate into relief. A veterinarian say it works for many acute and chronic disorder and pain conditions. In addition to serve as effective prevention and health maintenance technique, some veterinarians believe acupuncture is the best pain relief of all the alternative therapy.
For their pets.
Yeah, especially for chronic pain and relief of musculoskeletal symptoms from arthritis, disc disorder, and back pain.
Yes.
That's amazing. That's it from
No,
veterinary
it is amazing. I
perspective.
actually met a vet who was doing acupuncture while I was at school, and it was amazing. And again, what he's saying, pets can't lie. They're either better or they're not better. There's no placebo effect. There's no preconditioning. There's no pre-assumptions whether it works or it doesn't work. And it works very well on pets. So most of us are pet lovers anyways. So yes, even your pet, Dr. Fan is not a veterinarian, but even if your pet is suffering and conventional therapies are not working, there are vets out there.
Is a good option. Acupuncture right now, you research it, is a great option for dog, cat, and horse. If your dog and cat cannot walk, cannot move, and they would like to run, explore acupuncture options.
And again, no possible side effects, nothing to lose, right?
Absolutely. I think a lot of people not be aware that acupuncture is good for dogs, cat, and horse. My master's, who is a cardiologist and brain surgeon, he performed acupuncture on horses, and I witnesses that. Is amazing results.
Yeah, no, that's great. Thank you so much for being here today, Dr. Fan. I hope the people learn something, especially on how acupuncture works. We're trying to kind of bridge the gap between the Eastern and the Western terminology and make people aware that there's so many other things that this traditional Chinese medicine with acupuncture can help with, because most of us think it's just like, I have pain, maybe I'll try acupuncture, but there's so many other things they can be helped with, and you don't even need a trip from your doctor. Just go visit your local acupuncturist, and if you're in this area, contact Dr. Fan. Thank you very much for listening, and always remember, choose health freedom.